Now, when I was diagnosed back in 2011, I was 38 and I had high-risk disease that required almost immediate treatment. And I was put into hospital and had FCR about 8 months after diagnosis. And a friend of mine got breast cancer, and she and I ended up in hospital together, her with a breast cancer nurse holding her hand and, taking her through and providing family support, and me with no support. And that's why it's my great honour to introduce this next section, because supportive care for those of us living with CLL is just so critical, particularly because we live with this disease, hopefully for a long time, and you have to deal with the cycles of treatment, relapse, worry, and all the, the additional complications that Professor Shu talked about there. The next section, we're going to actually hear from two UK specialist health nurses who are so busy they can't be with us, but they will join us online in a bit to answer your questions. So I'm going to cue in a video that they've made for us, and that will start with Helen Knight introducing herself.
Hello, my name is Helen Knight, and we're honoured to join you today for the CLL Horizons 2024. Myself and Lianne Palmer is also a nurse. We're both nurse specialists within the UK. We're going to talk to you about our role and how we support patients. I work in Nottingham, which is a university hospital within the UK in England, looking after CLL patients specifically, and have done that for about the last 12 years now.
Hi everyone, thank you for having me on the call today. My name is Lianne Palmer and I'm a CLL clinical nurse specialist based in Oxford in the UK. I also specialise in looking after people with CLL and have been doing my role now for coming up to 10 years.
So Lianne and I, we're going to talk about our role as nurse specialists. We're going to talk about what that is here in the UK and what we've made it really over the last 10 or so years. We're also going to talk about supportive and holistic care, which is available, and how we implement that here. Health and wellbeing strategies, and also just to discuss at the end unmet needs and where improvements could still be made. So we looked at our role as a nurse specialist and what that includes. And it can include lots and lots of things, really. It's nearly a never-ending list, and it evolves and changes depending on what the need of the patient or the carers is. We can be there as information givers. We're there to answer questions. We try and solve people's problems where we possibly can. We're there to be advocates for patients and their carers, to signpost to other services, liaise with other caregivers such as GP practices and primary care. We're there to try and help counsel patients and their carers if needed. We can prescribe, some of us. We're there to try and troubleshoot or find those problems before they come up so we can avoid it happening in the first place. We help to diagnose and treat symptoms and also plan ahead when it comes to times of treatment. But it is very much, we have many hats that we try and cover lots of things for all patients to make sure that they can try and live their best life, really. So we looked at managing CLL and the patient and the nurse perspective and what that involves. And really a lot of those goals are very similar and have the same endpoint, but some things can be more important to others than those against the other patient. We looked at how we are with patients at the very beginning of their diagnosis, and us as nurse specialists, and Lianne and myself both try to be there at diagnosis. So we'll talk to the patient and their carers once they've been told their diagnosis of CLL or SLL. We're there to give information, identify any possible issues there may be, and provide that information at the right level and at the right time. We back that up with written information. I know we both give like new patient information packs, which has all sorts of information for social care, financial care, all sorts of health issues that can be useful to patients along the way. We offer clear guidance. We give a chance to ask questions, and that can be at any point. We give our contact details so that there is somebody that they can call at all times. They don't have to wait till their next appointment for that, and that we're on hand, really. So we try and help with a better understanding of what CLL means, what chronic means, because that can sound very bad, that this means slow growing in the medical sense of the meaning of the word. And leukemia, lots of people have a conception of what leukemia is, and having chemotherapy and losing your hair, which we know is a far from this diagnosis. So we're there to try and make sure that at the very beginning, patients have a really good understanding of what this means and how this may affect the rest of their life, really. So we're there to be a point of information and ensuring that they have all the information they need to make sure that they can live a good full life with all the information and make empowered decisions of what that means and going on in the future.
One other thing that we often do, just to add on to what Helen's saying, is discuss what like CLLB symptoms are, what the alert symptoms are, when to get in touch with the hospital teams in between hospital appointments, which I think can often be a reassurance to people, so they know what the symptoms are they're looking out for, and then what to do about it if they have those symptoms. And also actually understanding what the blood results mean, what we're looking for on the blood results, and what the treatment indications are for CLL. I think that not everybody wants all the information, and that's fine, but some people do find having that extra information can be helpful.
Trying to reduce anxiety, I think, isn't it, is our main aim, that we can make sure that people know all the right information, and we play a key role in helping patients navigate their way through that and tailoring that care to them, because everybody is different and there's no real set answers as well to some people's questions. So like, what level would my blood count need to be before I need treatment? And that changes for everybody as well. There's no set limits of what that may be. It does involve lots of other blood results and things, and different results at the same time, and symptoms.
And I think we can often be the middle link in a way between the patient and the CLL consultant. So when patients are telling us information, I think people can find it reassuring that we do have that link where we can go to the CLL consultants and get their expert advice where it's needed.
So really the CNS, we're playing a key role in planning as well. So when we do look ahead for treatments, some of those treatments are quite complicated. So we're there to try and help with the planning of that and which treatments will be best. So we are in a position now where there's lots of options for patients, which is amazing, really. Over the last few years, that's the landscape for treatment for CLL has exploded. So being helpful to navigate that is a key part for the nurse as well, to make sure that goes as smoothly as possible. So looking on to holistic care, here in the UK, we have something called a holistic needs assessment, with an electronic assessment that we can do. This is through Macmillan, which is a cancer charity in the UK, which provides a questionnaire that we can send out to all patients. It is a guideline here in the UK that all people with a cancer diagnosis should have access to a key worker or a nurse, or in most cases a nurse specialist, but that can be anyone as long as it is a key person that they have contact with. We try and do this at diagnosis for all patients. So it offers the opportunity, it's not mandatory, that people can choose to do this, but it asks questions on personal health, on your social needs, emotional needs, physical needs, pain, all sorts of things that may be affecting you. And then the nurse can then see this questionnaire, and we can then go through it, ask why people answered in certain ways, and they can mark on how much they see this as being a problem or a concern. They call it a concerns checklist. And this opens conversations really that may not have come up in appointments, where we can look ahead and see why people feel like that, and if there's anything we can put into place to try and make that better, to signpost to other services, maybe offer counselling, or whether it's just that more information is needed to be given so that the patient feels more at ease. So this is quite a nice way of opening conversations with people, really, and then accessing other services that can be available. And we heavily use charities as well. There are other cancer-related or blood cancer-related charities in the UK that are really, really helpful, that have support groups, they have buddy systems and things that we can all tap into so that patient can feel supported. And a lot of these are run by patients themselves, so much better understanding and be able to share their experiences as well. So a really good service to use.
So next, just following on from the health and wellbeing topic, as clinical nurse specialists, we do a lot of education on diagnosis, on how to live with CLL. And that can be things on vaccination, infections, maintaining a healthy lifestyle. Some protection about getting support if you're maybe smoking. Some people might want advice on losing weight, or it might be about exercising and how they're managing fatigue. But also what to tell others about the diagnosis, family and employers, and also travel insurance. So the list is quite broad. Following on from that, we have something called the CLL Hematology Service Information Guide for GPs, and this is an example here of the leaflet. Just a little bit of the history behind this. We've been using this leaflet, or one very similar, for a number of years now in Oxford. And what the idea of it was to improve the communication between primary and secondary care. And says that every person that we saw got the same information given to the GP surgery. And it's also an education guide also for the GP, so that the GP knows how to assess the stages of CLL, how to refer to a haematology service, what are the alert symptoms, what are the B symptoms, what are we looking for on blood results. And one of the key things actually was vaccinations. So in Oxford in particular, because that's where I work, we used to get a lot of queries from GPs, or maybe from the practice nurses or the patient themselves, not knowing what vaccinations they needed or when. Well, we found actually by putting this leaflet together and making it accessible for GP surgeries and practice nurses, it actually reduced the amount of queries that raised, which can only be a good thing for everybody. And the fact that it's much easier for the GP surgery and the practice nurse, so for the patients to turn up for the appointment for the vaccines, and the practice nurse know exactly what to give, rather than maybe the patient's being sent away and then them needing ring us and wait for us to get back with that information. And it's also obviously much better for the patients to get the vaccine straight away, and it's just a lot more streamlined. Following on from that, we've been using that for a few years. The UK CLL Forum and the CLL Support have actually taken the Oxford document and turned it into a national document, which is what we're seeing in front of us. So the one that we use in Oxford is more tailored for Oxford Pacific services, whereas this is much more broad. And what the idea of it is that anyone can use this in the UK. Any consultant or clinical nurse specialist can provide it for the GP surgery. And again, it's just to streamline the care, so that whether you're treated in Oxford or Nottingham or any other hospital, everybody's got access to the same information. So if you just move on to the next slide, and we can see there's like a section there on vaccinations. So this is the protocol that the GP surgeries would follow on what vaccinations we would recommend for people with CLL. So it talks about the pneumonia vaccines, about having 2 vaccines initially at diagnosis and 2 months apart, about having the seasonal flu vaccine, the non-live shingles vaccine, and then obviously the COVID vaccine, which we recommend CLL patients to have the boosters when offered. And it also talks about the fact that we don't recommend any live vaccinations, and there's a little section there on foreign travel. And it also again mentions there about patients being encouraged to stop smoking, and about sun safety and sun protection as well. So it's quite a detailed information leaflet there, which is quite useful for the GP surgeries to have. And then it's got the UK charities, the blood charity links on the leaflet as well. So in terms of the unmet needs for CLL patients, I mean, myself and Helen both work in the UK. We work in different hospitals. And actually there is no real set standard of care. Myself and Helen both provide for newly diagnosed patients what we call new patient packs. So information booklets, contact numbers, information on emotional support, the charities, benefit advice. But there is no set standard for that at the moment in place, and patient experience can vary quite a bit dependent on whereabout they live. As Helen already said, everybody who's got a cancer diagnosis should have a named key worker. Myself and Helen both work in quite big hospitals, so we are specialist nurses in CLL. Where for other patients, they might maybe work in a might attend a smaller hospital, where there might not be a set CLL clinical nurse specialist, but they might be a lymphoma clinical nurse specialist, where they're looking after lots of patients with different conditions. And there's lots of online information available, and there's lots of really good information available on the charities, but it's not necessarily always accessible for all, and not everybody always wants to reach out for that information. And that's why we try and make sure we give it in various formats. So whether it's written information, online information, or we give verbal information, so that we're covering all avenues of patients that myself and Helen see being able to access that information.
Wow, please give Helen and Lianne a big round of applause.